Hi, Morale.
Hi, Beth.
So let's imagine I'm a hearing care professional and I've got a lot of experience with Oticon Genie 2 and fitting Oticon hearing aids, but not so much experience with tinnitus patients. Can you walk me through what Oticon offers for tinnitus?
Yes, we've got quite a few offerings. So the first one is our Oticon Tinnitus Sound Support. So that is a generator that can be integrated into Oticon hearing aids, and when you're in your fitting, you can actually prescribe relief sounds to your patients. So that means that depending on the level of help that they need, you can provide relief sounds as a form of sound therapy for those patients. As well as that, we have the Oticon Companion app, and that's where the patients can actually make their own adjustments. So if, for instance, you've prescribed a relief sound and the patient is going about their day and they feel that they would like to increase the speed or decrease the speed, they can do that because we have this new feature called the Comfort Pulse. And there's 5 different speeds that they can select.
And by speed, you mean the modulation increases or decreases?
Exactly.
Yeah.
They can actually turn it off or they can increase or decrease it.
Okay.
Yeah. On top of that, we've got some new and updated tools that you can use either during the appointment with your patients or maybe some handouts that you can give the patient to take away with them, and also some that can help you with actually prescribing that help.
That sounds brilliant. It sounds like a really comprehensive package. So tell me more about the tools. What do you have to offer me?
Sure. So we have the Tinnitus Fitting Guide. This is a step-by-step guide on how to go about a fitting where you are also helping with tinnitus sound support. So it's got all of the steps for the journey here, and then it also touches on that companion app aspect that I mentioned earlier.
Okay, this looks really kind of practical, like step by step in Genie. I click here, then I click here.
Exactly. It's something that you can have on your desk or up on your screen during the fitting if you need to as well.
Okay, yeah, that looks really, really great for someone who's new to tinnitus sound support.
On top of that, we've also got the fitting checklist. So this is something that's very handy to have on your desk at all times. It takes you through different appointments and what you might need to cover. And of course, this will depend patient to patient. So there might be some things that you don't need to go through depending on the patient's journey, where they're at with that, and what you'd like to cover with them personally. But it is a really nice way to go through and make sure that you've covered everything that you would like to cover. And it's something that you can always refer to later on in the client journey as well.
Yeah, I can definitely see that would be useful. There's areas for inserting test results and guidance about when to put which programs on, and yeah, even supporting you throughout the whole journey. I think that's brilliant.
And it is something that you can refer to again during the patient journey as well.
Yeah, thank you. Is there anything else?
We've got this patient education and counselling tool, so something that you can use during your appointments. It covers what tinnitus is, what some common symptoms are. It's got some really beautiful illustrations, and it's a way to basically help the patient understand what is this tinnitus and how are we going to help them manage it. It's got a note section at the back as well, which I'll show you. All the way over here. And it's something that you can pick and choose. So you can select which pages are relevant. Maybe you want to go through some of them in the initial appointment, maybe some in follow-ups, and maybe some you don't need to at all. It's a really, really helpful guide for you to use during that conversation.
Yeah, so how exactly I should talk to my patient about all these different things.
Exactly.
Because that's something that's quite overwhelming if you've never spoken to someone about tinnitus before.
Yeah, and there's a lot of emotions attached. So it's a really great way to actually form how you want to have that conversation and how you want to approach the topic.
Yeah, I can see that would be really useful. And then how about anything to give to the patient themselves?
I'm glad you asked. We also have a guide that can be used as a take-home guide for the patient. So this is it over here. I recommend this specifically for those who may be a little bit anxious about their tinnitus. You can imagine it's a bit overwhelming to hear so much information during one appointment. So if they want to hear a little more or they're intrigued and want to research a bit more, this is the tool to hand out. It's also important to remember that about 90% of those who experience tinnitus are also experiencing a hearing loss, so it's a great way for them to really come into learning more about their hearing health. It's got similar information to those that you will have discussed in the other guide, but it also has a tinnitus dictionary all the way over here, which I think is really helpful, and some external links as well, so resources that they can refer to.
Yeah.
Really, really great tool for them to take home. And if they have any questions, they can discuss it with family members or get back in touch with you.
Yeah, that's brilliant. Yeah, it allows them to really digest the information that you've told them and have something to show their loved ones.
Exactly.
Yeah, brilliant. So why have these 4 been chosen to be updated?
These 4 have been chosen because they're some of the most popular ones. They're the most downloadable tools that we have available, and they really align with our new tinnitus offerings.
So where can we find these tools?
You can find them in Oticon Genie 2 within our Genie Resource Centre, which is right over there.
Thank you so much. It's great to have some information about what Oticon offers, and I'm ready to get stuck in now with my tinnitus patients.
I hope you find it all useful.
Thank you.